For my capstone project, I delved into the types of public health and medical resources that are available in Ethiopia. To understand this and the need for assistance in developing more resources for medical attention, it is important to note what types of illnesses Ethiopians are susceptible to. Ethiopians are dealing with a variety of different health issues that include infant mortality rate, low life expectancy, HIV and AIDS infection rates, preventable communicable diseases, nutritional diseases, and injuries from animal attacks that result in infection. There are a variety of reasons why these diseases are so prevalent. Many of them are due to low awareness of family planning, poor nutrition, shortages of trained health personnel, or even limited access to well-equipped health facilities and obstetric care, which we'll delve into later. The pyramid displayed here displays the hierarchy of the types of healthcare personnel that the majority of Ethiopians are exposed to. The bottom tier shows that the majority of Ethiopians are left to handle infection and disease on their own, whereas the top of the pyramid represents the amount of resources paid for and made available at a national or governmental level. Most villages of Ethiopia do not have access to any type of skilled healthcare professionals, so they have to resort to self-care. In many towns, instead of healthcare professionals, a health dispensary or government-sponsored clinic sits in as the main source of healthcare, though the majority are placed on major routes of transportation, so those in rural areas do not necessarily have access. Even in these clinics, there are often only 2 workers available, and they have limited resources because medications are so hard to come by. The majority of clinics have fewer than 10 medications available, in addition to medicinal herbs and first aid supplies for basic wounds. Medications include antibiotics, analgesics, anti-malarial medications, and vitamin supplements, but those do not cover the wide expanses of medical issues that many Ethiopians suffer from. Occasionally, vaccines become available through basic immunization programs, but they only really cover certain diseases, and citizens are still at risk. In major cities like the capital, Addis Ababa, more advanced care is available, though many people cannot afford to get proper treatment. Specialists like well-known Dr. Rick Hodes have the ability to diagnose patients and tell them what needs to be done in order to improve their health. But many times, the surgeries are only possible if offered a medical grant. Even once given the opportunity to receive life-saving surgery, many times the patient will have to leave Ethiopia to get the surgery done in another country. I've spent some time with Dr. Rick Hodes, meeting with him to discuss the state of the clinics and hospitals that he works hand-in-hand with in Ethiopia. I was even able to sit in to see him at work during my time spent in Ethiopia in one of the clinics that he works in. He very specifically works with patients with spinal and heart diseases. One of the most prevalent of spinal diseases he works with are those with tuberculosis of the spine in children. Through his connections with the Joint Distribution Committee, he has limited funds to be able to send these patients to India and Kenya for spinal and heart surgeries respectively. These are the closest and most affordable medical centers for Ethiopians to use. Since Ethiopia's surgical resources are so scarce, they are forced to rely on other countries for emergency procedures such as this. Shown in this chart are the population numbers in relation to the types of healthcare that are available for use by citizens, as well as the number of up-and-running facilities for healthcare throughout the country. Even after receiving care, many Ethiopians have difficulty recovering. There aren't many options for rehabilitation in terms of physical or occupational therapies throughout the country. Though there are public health resources for post-surgery patients to use in order to rehabilitate, there often aren't ways for them to attain the large amounts of money to cover costs or get to a place that has these types of resources. This can be extremely detrimental considering the daily life of an Ethiopian generally includes excessive amounts of physical labor, including walking miles from place to place just to get to the resources they need to survive. There are 2,000 doctors for over 70 million people, rarely any anesthesiologists, 10 psychiatrists, and a greater shortage of specialists to boot. The Ethiopian public health system could be easily strengthened by an increase in professionals. Among the 75 million people that live in Ethiopia, they also have become responsible for approximately 170,000 Somali refugees that were escaping conflict and effects of the recent drought. In addition to these refugees, people that are fleeing from the violence and genocide in Sudan and South Sudan are also entering Ethiopia in need of medical attention. A huge improvement could be seen if there were more students being taught in the inner workings of medical care and started creating more doctors and specialists on their own instead of relying on the resources of other countries. In addition to creating more internal health professionals, Ethiopia could greatly benefit from having a better understanding of public health and a wider framework for health education of its citizens. As a preventative framework for lowering rates of disease, schools are particularly important for adolescent sexual behavior interventions and disease prevention education. Ethiopia has such a prevalence of public health issues such as the communicable diseases, malnutrition, limited economic resources, large child population, shortages of trained staff, and medical facilities that were discussed previously. Since there has been such an increase in the interest in education because of the increase in development of the country, beginning with health education and how to become or stay healthy in a place where disease is so easily infested would be a great start. According to the Ethiopian Public Health Association, creating an organized health education program would work worlds on this country. Though it could still stand to improve on the amount of access to public health professionals have to medical resources and exercise equipment to help assist the recovery process of those post-operation or post-disease. Creating nursing and medical schools is an excellent start, but adding schools of public health could help increase the longevity of their patients' lives and cut recovery time in half. The less a person has to rely on others or medication, the better, because resources are so thin, and as a result of the culture and accessibility, Ethiopians rely so much on physical labor to survive. I hope this presentation has enlightened you on the situation of healthcare and medical access in Ethiopia. There is still so much more that can be done in this developing country to improve the lives of its citizens, and I feel like the ways discussed in this presentation are a great place to start.